We are going to start a series of live speaking role play sessions for both the doctors and the nurses on a daily basis, recurrent episodes. So we are going to do some research together. You and I, we. Get ready. Prepare your own sentences. I'll give you your turn. Okay, I'll give you your turn. One by one, you will be participating in the speaking sessions and you will be typing your sentences. Yeah. Yes. Now we are first stage, stage one. Stage one is called breaking the ice. Breaking the ice. So first stage is called breaking the ice. It's I don't know you, you don't know me, we don't know one another, like that. Let me introduce myself to you, you introduce yourself to me. So first starting with the nurse. Nurse is going to break the ice. You are the nurse. I am not the nurse. I am the patient's. I'm the patient or I'm the role player. And I am the caregiver or whatever you think. That's different. So break the ice. Write down your own sentence or whatever. Break the ice. Yes. How are you going to introduce yourself? First of all, you have to know some things here. Okay, what is the setting? Who are you? And who is the patient? How old is he? Come on, ask the questions. Our organizer, our coordinator will be asking the questions. Ask whatever questions you want. There is a coordinator, and you know her very well. She'll be asking some sentences. Right. So, first, background. Understand the background. What is the background? Yes, coordinator, please. Okay. Right. I will be leading it. What is the background? Come on. What is the background? What is the background? Should know. What is the background? Come on, respond, all of you. It's going to be a seminar. What is the background? Is it a ward, or is it a surgery room, or is it a post-operative ward, or is it emergency ward, or is it a reception? What exactly? Yes. Come on, one by one. Right. Background. What is the background? The background is a post-operative ward. That's absolutely right. He has been admitted to the hospital and he went to the surgery and he came out and he's just relaxing in the post-operative ward. Yes, that's absolutely right. And what is your designation? The second question is, what is your designation? Who are you? What is your designation? What is your designation? Yeah. What is your designation? What is your designation? Okay. What is the case? What is the case? Means what is the problem? What is the problem? What is the problem? What is the case? What is the thyroid gland removal? Okay. Yes. What is the current condition? She has three main problems now. The current problems are three. She is unable to do three different things properly. She is unable to do three different things properly. What are those three different things? What are those three different things? Three actions. She is not able to do three actions. Yes. Yes. Now let us see. So first point, there are how many bullet points are there? 1, 2, 3, 4, 5, 6, 7. How many bullet points are there? You can see the bullets there. Yeah. Now we are going to start. Number 1, introduce yourselves first. Or how to start. Set the wheels under motion. Set the wheels in motion. Start. How are you going to start? So now we are going to break the ice. That means initiate the dialogue. Initiate the dialogue. Dialogue means two people speaking is called a dialogue. Introduce the dialogue. Initiate the dialogue. Yeah. Initiate the dialogue. Come on, write down. Initiate the dialogue. Yeah, write your own sentences. Write your own sentences. Introduce yourself and introduce. Guess what you will start? How will you start the conversation? 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 I'll give you a chance to speak. Those who are participating very nicely, okay, our coordinator will call you and will conduct a speaking session for you. Yes. My name is Esther. I am the head nurse in this hospital ward. Before we begin our conversation, Muttu Lakshmi. Good evening, Mrs. Martha. How are you feeling now? I am Lakshmi. I am Lakshmi, your attending nurse today. Avil. Good afternoon, Miss Martha. I am Avil, one of the registered nurses working in this hospital. Capital letters. Yeah. Is that everything? Do you want to write some more things? Geeta. Hello. Hi. Good evening. I am Geeta, one of the registered nurses working in this hospital. Okay. You should not say hi. You can say only 4 different things or 5 different things. Good morning, good afternoon, good evening, good night. These are the 4 things that you can tell. And in addition to that, you can say good day. Good morning, good afternoon, good evening, good night, good day. These are the words which you can use. Yeah. So you can say like this. Don't use the word. Avoid saying hi, hello. These are informal greetings. Avoid informal greeting. Avoid informal greetings. Use only formal greetings. Use only formal greetings. You can say good morning, good afternoon, or good evening, or good night if it is night, or good day. Good day, gentlemen. Good day. So these are the things which you can use. Yeah. So now you are the head nurse and you are attending on a patient who has undergone an operation for thyroid gland removal. The patient is unable to speak properly and she has difficulty in swallowing or even breathing properly. Don't be complacent. Be open. Be generous. People may think that, this is a known case. Sometimes it may be a known case, sometimes it may be an unknown case or whatever, according to the situation. For example, maybe you are first time visiting, maybe that's a very big hospital, okay? And you are seeing the patient for the first time. Anything may happen here. This is a very big hospital. Maybe you only have taken him to the operation theater and you were there while admission. Maybe anything is possible. You can think whatever comfortable you are. Okay. Yeah. Yes. So, patient is already there in the hospital. So you may be knowing or you may not be knowing. Anything may happen. Maybe it is afternoon shift and the patient had operation in the morning and now only you are joining duty. You have taken charge from another head nurse, morning outgoing nurse, and now you are incoming. So it may happen like that. Anything may happen. So whichever way you are comfortable, if you feel that you are seeing the patient for the first time, that's okay. Yeah, thank you. So anything may be possible. What do you think? You know the patient or you do not know the patient? Write your own style according to your understanding. Anything is possible. What do you think? You know the patient or you do not know the patient? Write down. Imagine yourself in the situation and write down. For example, I think I am the nurse, suppose. I am the head nurse. I can think in any way. Okay? I can think in any way. No problem. Yes, come on. So, what are the different sentences you can speak? This is number one. Question number one. Introductory phase or breaking the ice phase. Breaking the ice phase. This is the first question. Now, in this, how many sentences you will write? My first sentence is I will not say hello. I'll say good morning. I'll say good morning. Yeah, come on. First sentence is good morning. Maybe I know the patient. Maybe I know the patient. Maybe I don't know the patient. It may be anything. It may be anything. Yeah. So, good morning. My sentence number two is my name is Esther Grace. This is sentence number two. My name is Esther Grace. Maybe that patient doesn't know me. She's seeing me for the first time before some other staff nurse has gone or registered nurse has gone or ward nurse has gone. But first time I'm seeing this. Maybe my wish. I can think anything. There is nothing given. Background information is not full. So you can imagine whatever you want. There is no problem at all. Don't limit yourself. Don't be complacent. I am the head nurse. I am the head nurse. Number four. Okay. What else you can say here? Come on, write down your sentences now. Write down your sentences. And the purpose? Can you please tell me your name, age, and the purpose of our meeting today? Can you please tell me your name, age, and the purpose of our meeting today? Yeah, Geeta J. Kumar. Yeah. Is my voice audible? Yeah, that's fine. Go ahead and write your sentences. Now begin with warm and friendly greetings. So that is the introduction. We finished. Breaking the ice is finished. Come on, give your own sentences. So next sentence may be like this. Okay, now point number 1, BP 1, blood pressure 1, bullet point 1, bullet point 1. So begin with warm and friendly greetings. Begin with warm and friendly greetings. Yes. Yeah. Build up. Build up the scenario. So build up the scenario. Breaking the ice. Next one is building up the scenario. Build up the scenario. How are you going to build up the scenario? Now let us see. Yeah, after she tells like that one, okay, she will tell, okay, now what do you expect the patient to tell? Now patient's role. Patient's response. You only give. You should be ready to guess. Come on. The interlocutors also can participate. Patient's response. What will the patient tell now? What do you think? You're asking something, so how will the patient respond? You only imagine. And you want to see the patient's card? Yeah. Patient's card is here. Yeah, that is the patient's card. Come on. You only imagine yourself as a patient, and now you think what the patient will tell, because based on that one only you will develop your sentence. You are taking the role, two sides of the coin. So if you don't ask properly, he will not answer properly. Whatever you ask, he will tell or she will tell the same thing. Okay. You are a patient now. Imagine that you are a patient. Okay, name is not given, so you can give your own name. If you already know the name, you will tell them, hello Martha, how are you? Like that. See, for example, yes, yes, responses are coming very good. For example, if I am going to speak, yeah, third answer, yeah, very good. So imagine, there is no feeling, there are no feelings. There are no feelings in your sentences. There are no feelings. You're just like a machine, you are talking, like machines, robots. That feeling is not there when I read the sentences. Okay, I cannot feel the feelings. Your feelings, I should feel. I am feeling very anxious. So you are saying, I am feeling very anxious. Instead of, I'm anxious, nurse. It's very difficult for me. I cannot manage many things. I cannot speak properly. And one more thing, when I swallow something, it's difficult. The water doesn't go into the throat directly. It's tough. There's some sort of pain. It's difficult. And breathing also, I think the air gets stuck in my throat. It's not an easy task. How can I tell you, nurse, all the pain that I'm feeling? I cannot tell in words. This is how they speak. Then only you can understand, right? Yeah, right now. Now you'll start. Friendly greetings. Right. Yeah. Now think about all the things there. Yes, Geeta Jay Kumar, very good. Today's everything will be made into a copy and given to you. So write down all the sentences. I underwent thyroid surgery, not underwent for. I underwent. Yes, come on. Now answer questions that Mishi may ask. Okay. I'm feeling pain in my throat. I cannot gulp water. It's very difficult. Forget about eating food. I cannot even swallow water. Forget about eating food. I cannot even drink water. I cannot even swallow water. It's becoming tough. Yes, next. Now you can answer this question. Answer questions that she may ask. How long will it be, nurse? How long will it be, nurse? This pain will be for how more? How long? How much more time? Is there anything that I can do? Yeah, come on. Bullet point 2. Answer the questions that bullet point 2 or BP2. BP2. Providing relevant information that she is asking. She's asking some questions and you are giving the information regarding that. Why am I facing this pain, nurse? How long will this condition continue? How long will this condition be? How long should I endure this pain? When will I be able to? When will I be able to speak properly? When will I be able to speak properly? It is difficult for me to swallow food. Okay. Even breathing is difficult. Can you please explain me the reason why I am facing this problem? Come on, answer the questions, all of you. Yes. That is our interlocutor, our coordinator. Sample set given by our coordinator. Note down. And you can write your own sentences. Give your own sentences, please. Come on, all of you, type your answers. I'm waiting for you. We are going to become dynamic. Forget about a B grade, you will get a B plus. Every day we are going to do one speaking role play session like this. And if you work hard on a daily basis, the students can score even B plus and A grade. Many students who scored A grade. So it's not a distant dream. Yes, good evening, Srija. Now you have answered these questions. So this next one is BP3. That is reassuring the patients, offering, providing reassurance, providing reassurance, providing reassurance. I absolutely agree with you. Now see the answer. For example, I'm answering this question. Yeah, I understand, nurse, that what you tell me, it will take at least a couple of weeks. That means a fortnight or 15 days, 14 to 15 days. I can understand. But the thing is, how can I manage this for so many days? Is there no other way for a faster recovery? Is there no other possible method or no other possible measures to speed up the recovery process? You can tell me, nurse. You can suggest me what I can do. I'm ready to do anything you say because you know it concerns my health. I don't want to take any risk. Write down my sentences also. It is there on the YouTube afterwards. And these sentences you can use as a nurse. You can modify them. I want to speed up the recovering process, nurse. I don't want this condition to last for 2 weeks. If possible, within a week or even lesser than that. I want to recover faster. I'm ready to comply with every suggestion that you provide. These sentences you can use as a nurse. The doctors and the medical professionals will give all the suggestions required for you. And if you are compliant with these suggestions and recommendations, definitely you can improve well in advance within a week or so. Bring the charger, no, I will. Yeah. Next one. Come on, all of you. Very good. Provide reassurance. That's a valid expression on your part, Miss Martha. It's the common problem for those who underwent this, you'll be able to speak and swallow and back to normal. Yeah. Jackson Kirimi, I understand you have recently undergone a thyroid gland surgery and this could be causing the symptoms you are undergoing. However, this is a common problem that all patients who undergo when they have surgery. And what I can reassure, the symptoms are there for just a few days and everything will be back to normal. I have witnessed a number of patients in my lifetime, in my experience, in my lifetime experience as a nurse. Okay, I have been a nurse for almost 10 years. And during this period, I have witnessed innumerable or countless patients overcoming this problem. No, Deepika, class will always be there and it will be in the regular group. Personal messages, different. You are in the group, no? You have to check from the group, please. Okay, individual messages, they will be coming slowly. If you don't come in the group messages, then I'll be sending you in the individually. Yes. So the group, let me check. Maybe 2 times or 3 times the message is sent in the group already, not one time. Check in the groups. Otherwise, check in the Telegram group. Group is the best one. Okay, Telegram group. See, Telegram group. See here, Telegram group. The message was sent at what time? We started at 4:36. Yeah, of course. 4. I just put the message 4 o'clock. I saved that one at 4 o'clock, but I sent at 4:36. Yeah, 4:36 only. Yeah. And class actually started at 5 p.m. Yeah. I create a message like that. Okay, 4 o'clock or 4:30. That time I'll create and keep. Then I'll send that message. And when I send that message, yeah, you're not late. You're right. You're right only. Yeah. Because I'll write a 4 o'clock or 5 o'clock or 6 or some message when I create that one and I'll send up. So when I post it in the Telegram chat, immediately I'll start the link. See here. All of you, don't just really, when you get the message, that message timing is correct. So you have to see here, this is 4:36. I sent the link at 4:36 and then immediately I started the Zoom. And afterwards, first I will send in the Telegram only. Then I will send in the WhatsApp. This is December OET preparation, December nursing. Okay, Deepika Chandigarh, you are in this group. Deepika Chandigarh, you are in which group? Let us see. Yeah, in the December group, regular. Yeah, in your group, see, messages. They have come almost 2 times. So here, number 1, this came at 4:37. And then again, another time it came at 4:59. So 2 times the message is sent and afterwards only we'll send personal messages. So no problem. Right. Yeah. Good evening, Kiran. Come on, participate actively, please, all of you. We're coming to the end of the session. View full screen mode. Yeah. Okay. Next, reassuring the patient. Come on, reassure the patients. And the problems related. Okay, how much time it takes? Okay. The healing will be gradual. Slow and steady wins the race. You can use the idiom or quotation. The recovery will not be overnight. You cannot recover. You cannot recover from this medical condition overnight. Healing is a gradual but a definite process. It will take its natural course of action. The mean time, the mean or the average time on on an average, it might take a fortnight. It might take a fortnight for you to recover completely. If you are strong enough, if you are strong enough and medical and 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 if you are strong enough and compliant with not only medication but also but also dietary regimen, in addition to exercise programs, the recovery process may be the recovery may be sooner than expected. It entirely depends on your endurance and compliance with the recommendations of the doctor. On the other hand, if you are not compliant, the duration the duration required for the healing may be extended by another week. So you can speak anything you want, but limit to those things. I'm giving you sentences so that you can practice. Okay. Now, BP4, bullet point 4, professional offering professional guidelines, guidance or counseling or suggestions, professional recommendations or guidelines, whatever it is you call. Now you are telling what to do, do's and don'ts. Recommendation means rules, regulations. These are called do's, okay, and don'ts. Do's and don'ts. On the positive note, On the positive note, resting your vocal cords is of utmost priority. On the positive note, resting your vocal cords is of utmost priority. Resting your vocal cords is of utmost priority. It is secondary to none. So it means primary, it's secondary to none. So it is the most important point. That's the meaning. Okay. My sincere suggestion for you is to control your impulse to speak more. My sincere suggestion for you is to control your impulse to speak more. Minimizing the speaking time and maximizing and simultaneously maximizing your patience will undeniably increase the pace of recovery. I'm giving you different styles, so you can use whatever you want. Do not ignore the importance of the recommendations provided by any medical professional. Do not ignore the importance of the recommendations provided by any specific medical professional. For instance, the dietary guidelines offered by the dietitian, the exercise programs suggested by the physiotherapist. I'm not talking about this only. I'm talking about everything possible, whichever is possible that you take and use in that particular speaking role play card. Physiotherapist, and last but not the least, use this phrase, and last but not the least. So when you're telling about a last example, you can use this, and last but not the least, the the advice provided, the advice given by the, many people say the advices. No, advice is uncountable. The advice given by your general practitioner, by your doctor, by your physician, by your physician. Do not ignore the importance. Do not ignore the prominence. Okay. So this is a list. I have made a list here. You see. Do not ignore the importance of the recommendations provided by any specific medical professional. Colon. This is one sentence. Actually, there are 4 sentences in this sentence. It is called a listing of things. Do not ignore the importance of the recommendations provided by any special medical professional. Is to means colon. That means is equal to, this entire thing is equal to 3 things here. Number 1, for instance, the dietary guidelines offered by the dietitian. That means do not ignore the dietary guidelines offered by the. So that is number 1. The exercises programs suggested by the physiotherapist. That is number 2. And the advice given by your physician. That is number 3. So don't ignore number 1, number 2, number 3. The complete one is on the left side and 1 plus 2 plus 3 on the right side. That's it. So they are balanced. This complete is equal to 3 points. That is balanced. This is how you make list. If you make list, you will get 10 to 20 points. If your listing is good, you'll get 10 points. If your listing is perfect, flawless, you'll get 20 points. One listing is enough. One listing in the OET letter, one listing, you'll get 20 points, no doubt. Yes. Now there is next one. Yeah. Now next one is, so precautions, post-operative precautions. Post, next one, bullet point 5, BP 5. Post-operative precautions or measures. Post-operative precautions are measures. Post-operative precautions are measures. Post-operative precautions. That is bullet point 5. What you have to do? Elevating the head is of utmost importance. Is mandatory. 24/7. Yes. So, number 2, for the first 4 to 5 days after surgery, even while sleeping. So, write down these points. Elevating the head is extremely important. Elevating the head is of extreme importance, or is extremely important. Yeah. Especially during the first week, especially during the first week post surgery, especially during the first week post surgery, especially during the first week during post surgery, elevating the head is extremely important. Yeah. And next, why should it be there, elevating the head? Why? The purpose you tell. What is it? Is it for the smooth blood circulation, or what? Why? What is the reason? Why people say elevate? Yeah, to reduce the pain. Yes. Type. Yeah. Yes. So preventing aspiration. Yes. Yeah, come on. Yeah. Now prepare very nicely. Okay. How many of you are ready to do the speaking session with me? How many of you are ready to do one speaking, this speaking session, this speaking session? Yeah. Can you conduct the speaking session? Yeah. So the interlocutor, the coordinator is ready to take speaking session. Yes. And afterwards, yeah. No, first you will do with the coordinator, not with the interlocutor, coordinator. Okay. So Meera will be taking the speaking session. Meera Manoj is the coordinator. She will be taking the speaking session and she will record and she will send me. After that, I will select some students who are performing very excellently. Then I will take a live session for them. Yes, every day I'm going to take one speaking card like this, one for doctors and one for nurses. Every day. So those who are ready can submit your names here. Those who will prepare and come, their names will here. Last, the conclusion, the closure. Bullet point is over. All the 5 bullet points are over. The closure, the closing point. How are you going to conclude the speaking? How are you going to conclude the speaking? I strongly believe that I have given you the necessary relevant information, necessary guidelines, and appropriate measures. Try to use quality. Try to use quality. Bounce back like a boomerang. I strongly believe that I have given you the relevant information, necessary guidelines, and appropriate measures to the best of my knowledge, wisdom, and experience. I strongly believe that I have given you the relevant information, necessary guidelines, and appropriate measures to the best of my knowledge, wisdom, and experience. I'm giving you so many sentences. If you take even 1/5 of that one, you can do the speaking session very perfectly. Yes, sir. Note down Geeta Jayakumar. I'll give you the numbers afterwards. The coordinator will. Not now. Not now. I'll tell you, not timing. Let them prepare first. Let them prepare for at least half an hour. So, I will note down the name Geeta Jayakumar. So, record the speaking sessions and give me. I will tell you the timing. Timing also I will schedule. Na? Already. Yeah. So, next, Avil Narona, ready, number 2. Yeah. All of you who are ready to participate, the recording I'll get. Next, conclude. In case you require any additional information, Kiran Kaur, in Kiran, Delhi. In case you require any additional information, comma, please do not hesitate to ask me. I am ready to discuss anything which falls within my understanding. In case I do not know, I will arrange a meeting with the doctor and you can discuss with him. Thanks very much for patiently listening to me. Oh, thanks very much for patiently listening to me. 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 Yeah. I wish you a speedy recovery. So you can use these sentences and you can practice on a daily basis. Every day I'll take one speaking session. Right. So at the end, provide your valuable feedback. Provide your valuable feedback. Yes. So we have 1 minute more to close the session. So you can provide your feedback. Today we'll start the evening session a little late because just now I closed. No, I'm going for a walk, and the evening session a little late will start. Yeah, that's the end of this session.